Protocol. Eligibility criteria. The inclusion criteria. Patients need to be 18 years and over with a clinical diagnosis of mild asthma. They need to be treated with low-dose inhaled corticosteroids, but please note it needs to be a brown single inhaler such as Clenil. Prescribed 11 or fewer canisters of salbutamol in the last 12 months, and have the ability to provide written informed consent. For the purposes of the trial, mild asthma is defined as those patients with an existing clinical diagnosis of asthma, which is recorded in medical records, and treated with low-dose inhaled corticosteroid and salbutamol. No further diagnostic tests will be undertaken to confirm asthma or its severity. We want the trial to be pragmatic in nature and therefore include patients who are currently treated for mild asthma. The low-dose inhaled corticosteroid is defined as up to and including 400 micrograms of beclomethasone dipropionate per day or equivalent. But please note that Qvar and Flixotide are double potency, so a maximum of 200 micrograms per day. Patients using salbutamol alone and using 3 or more inhalations per week can be included if started on a low-dose inhaled corticosteroid at least 4 weeks as part of their routine care before entering the trial. Exclusion criteria. Salbutamol used only to prevent exercise-induced asthma, and any other respiratory or non-respiratory diagnosis which will affect the trial interpretation in the view of the investigator, such as smoking-related COPD and clinically significant bronchiectasis, or any other clinical condition needing regular oral steroid treatments, for example Crohn's disease, or patients with dementia due to consent issues. Patients who are pregnant and who are intending to become pregnant can't be included, and this is for insurance purposes, not safety. Please note that patient eligibility must be signed off by the GP prior to entry into the trial as per the MHRA guidelines. Patient identification. A screening tool is being developed to generate lists of all potentially eligible patients, and this via System 1 or EMIS. The number of potentially eligible patients and the number sent an invitation should be entered onto the trial database. There's more information on data entry later. But please note only GPs and site staff have access to this list. The GP checks patient meet the inclusion criteria, and if yes, please send the list to .mail. We will send out an invitation letter and a participant information sheet, and with the reply slip for patients to return to your site. Alternatively, the site can send out invitation using AccurRx or similar, which will contain a link to the invitation letter and participant information sheet. Approved language must be used in all communications. Site preference for patient level contact is noted at the NCTU. On receipt of the reply slips or responses, we ask that you please contact patients to arrange their first baseline appointment, and there's more on assessments later. Potential patients can also make direct contact with their GP or the research team as a result of trial advertising and promotional material, for example posters, leaflets, the NCTU and social media. Interested patients contacting the NCTU will be signposted to their participating site. Patients can be identified by direct invitation during a consultation or asthma review, but must be given time to read and understand the participant information sheet before a baseline visit is arranged. The participant information sheet. Interested patients will have been sent a personalised letter introducing the trial and research staff contacts and a participant information sheet, and that would have been sent via .mail, AccurRx or similar. A copy of the participant information sheet is also made available to sites. Please note that there is a separate participant information sheet available for those taking part in the qualitative sub-study, but this will be sent by the qualitative team and not from your site. There is an enhanced participant information sheet which will be sent to sites if they're part of the study within a trial, also known as the SWOT. Sites will be provided with the relevant participant information sheet, and there's more information on the SWOT later. Please do ensure that the correct participant information sheet is provided prior to booking the baseline appointment and obtaining informed consent. Informed consent. Consent can only be taken by the GP or suitably trained delegate, for example, investigators or research nurses, etc., if this is approved at your site. There is free GCP and consent training available via the NIHR website. Informed consent can be face-to-face, wet ink, or remote via e-consent. Consent processes will be explained in detail later in the training. It is important, if e-consent is chosen, that the site staff member undertaking the baseline appointment answers any question the participant has and verifies that they understand what they are signing up to. This must be done prior to randomising remotely consented participants into the trial. Withdrawal and discontinuation. If a patient withdraws their consent prior to randomisation, they will not be randomised and no follow-up data will be collected. Patients may also withdraw their consent for follow-up and/or other trial-related activities or receiving trial-related communications any time after randomisation without giving a reason. The NCTU must be informed of all requests by patients to stop their involvement in the trial as soon as possible, and this via the change of status form on the trial database. Appropriate action will be taken to ensure the patient's wishes are fully established and followed. Treatment discontinuation. It is not anticipated that a patient would need to be removed from trial treatments. Patients are encouraged to stay on allocated treatments, and any changes must remain with the constraints detailed in the protocol where possible. However, if a patient's maintenance low-dose inhaled corticosteroid inhaler is changed to a combined inhaler during their time in the trial, for example, if their asthma is deemed more severe and the patients to use the combined inhaler for maintenance, they will no longer meet the eligibility criteria. Patients who discontinue the study treatment or change treatment for any reason will continue to be followed up in accordance with the trial schedule if they are willing to do so. Protocol non-compliance will be monitored via central monitoring of electronic case report form data, and any protocol deviations and/or violations will be recorded on the trial database and reviewed by the NCTU. Treatment non-compliance is not a protocol deviation, however. Pregnancy during treatment. If a pregnancy occurs in a patient who is in either arm of the trial, they will be withdrawn from the trial and the database updated accordingly. Site staff will be required to complete both a pregnancy notification and a change of status form on the trial database. Pregnant patients should then follow the direction of their GP regarding their asthma treatment. Due to the change in treatment and the low risk associated with the trial medications, no trial-related adverse events in the mother or child are expected in this trial.